Okay, thank you for tuning in. This is Sharonda, and this is my Spreaker podcast, Health Matters, as well as my under my YouTube channel, The Holistic Health Approach, Health Matters. And so today's topic is sepsis. So what is sepsis? The website I'm on indicates that sepsis is a body extreme response to an infection. It is a life-threatening medical emergency. Sepsis happens when an infection you already have triggers a chain reaction throughout your body. Infections that lead to sepsis most often start in the lung, urinary tract, skin, or gastrointestinal tract. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. So it has some key facts here. It says anyone can get an infection, and almost any infection, including COVID, can lead to sepsis. In a year, at least 1.7 million adults in America develop sepsis. Nearly 270,000 Americans die as a result of sepsis. 1 in 3 patients who die in a hospital has sepsis. Sepsis, or the infection causing sepsis, start outside of the hospital in nearly 87% of cases. So is sepsis contagious? You can't spread sepsis to other people. However, the infection can lead to sepsis, and you can spread some infections to other people. What causes sepsis? Infections can put you and your loved one at risk for sepsis. When germs get into your body, they can cause an infection. If you don't stop that infection, it can cause sepsis. Bacteria infections cause most cases of sepsis. Sepsis can also be a result of other infections, including viral infections, such as COVID-19 or influenza. So who is at risk? Those adults 65 years and older, people with chronic medical conditions such as diabetes, lung disease, cancer, and kidney disease, sepsis survivors, people with weakened immune systems, people with recent severe illness or hospitalizations, children younger than 1 year old. What are the signs and symptoms? Okay, so the signs and symptoms of sepsis is high heart rate or low blood pressure, confusion or disorientation, extreme pain or discomfort, fever, shivering or feeling very cold, shortness of breath, clammy or sweaty skin. A medical assessment by a healthcare professional is needed to confirm sepsis. What should I do if I suspect sepsis? Sepsis is a medical emergency. If you or your loved ones have an infection that is not getting better or getting worse, act fast. Get medical care immediately, either in person or at a minimum through telehealth services. As your healthcare professional, could this infection be leading to sepsis? And if you should go to the emergency room for a medical assessment. If you have a medical emergency, call 911. If you have or think you have sepsis, tell the operator. If you have or think you have COVID, tell the operator this as well. So you can wear a mask in the event that medical help arrives. So, and this concludes my presentation on sepsis. And I do thank you for tuning in to this episode of Health Matters. Until then, you have a safe and wonderful day. Good day.